Hello, welcome to another episode of video on ultrasound, starting from a blighted ovum. So, it is possible for a woman to experience all the signs of early cirrhosis or early pregnancy, such as pelvic pain, fever, headache, nausea, and vomiting. And then, when a woman do a test for HCG, it is possible to have a positive pregnancy test. But when a woman book for an ultrasound scan for a confirmation, there is a large gestational sac without an embryo or yolk sac present inside the sac. That is blighted ovum. The sperm has been fertilized the egg. There is a formation of fertilization between the sperm and egg, but the fertilized egg will be implanted in the uterus, in the endometrial cavity of the uterus, but it's not developed at all. It's just a large gestational sac. There is a large gestational sac implanted in the endometrial layer of the uterus, but there is no a yolk sac or embryo present in the sac, meaning the sac just develop without developments of the embryo or yolk sac inside. It's just an empty sac, just like this one I display on the screen. If you look at it very well, it's a large gestational sac and is implanted in the endometrial cavity of the uterus. But if you zoom it, if you magnify it and look at it very well, it's just an anechoic sac. There is no yolk sac and there is no embryo developed in it. It's just a empty gestational sac. This is called an blighted ovum or an embryonic pregnancy. Some people call it an embryonic pregnancy, meaning the pregnancy that is not developed at all. And then this blighted ovum is the number one cause of miscarriage in the first trimester. About 80% of the miscarriage in the first trimester are due to blighted ovum or an embryonic pregnancy. Sometimes you see a large gestational sac without embryo or yolk sac, but sometimes you can see it with a yolk sac, but instead of the embryo to develop early, but embryo does not develop at all. This is also called a blighted ovum. And sometimes you can see a large gestational sac with a yolk sac or with an embryo. But instead of that embryo to keep on developing, to keep on growing, the embryo will stop developing very early. The embryo, even when there is a formation of embryo, when the embryo stop developing or growing very early, this is also called a blighted ovum. Or sometimes you can see it with a irregular wall margin, or you can see it elongated or have a irregular shape. This is also a definition of blighted ovum. On ultrasound, if you use a mean sac diameter or MSD and measure the mean sac diameter of the sac, it reaches about 20 to 25 millimeter. Any gestational sac without a embryo, without a yolk sac, and you measure its mean sac diameter reaching about 20 to 25 millimeter without a embryo or a yolk sac. This is definition of a blighted ovum. And then blighted ovum cannot be reversible. You cannot reverse it with any drugs to make it a good pregnancy. You cannot, unless you need to terminate it with drugs, abortion pill, or this misoprostol, mifepac, or mifeprostone to terminate the pregnancy, to flush it out, because you cannot reverse it into a real or true pregnancy. And then the cause of this blighted ovum are chromosomal abnormalities or chromosomal defect in the fertilized egg. Maybe as a result of DNA problem, when there is problems in the DNA of the fertilized egg, or when there is a problem in the chromosomes of the fertilized egg. this can lead to formation of a blighted ovum. And then it's very possible for a woman to have a blighted ovum for the first pregnancy, but in the second pregnancy she can have a good pregnancy. So just here we are doing it for the purpose people who are learning ultrasound scan. So this is very important information that I'm going to give you now. Just use your probe to scan a uterus, a longitudinal plane and a transverse plane. Manipulate your probe to see the gestational sac very well, to magnify it full length of the gestational sac. When you see it very large without a yolk sac or embryo, try to measure main sac diameter of the sac. When you measure it, when it reaches 20 to 25 millimeter without a yolk sac or embryo, so this is just a blighted ovum. But if your machine has no good resolution, don't to diagnose a blighted ovum when you measure it 25 millimeter. Just wait to reach a 30 millimeter when you have or maybe you ask a patient to come for a scan after 2 weeks to confirm, because your machine is not the very resolution. Maybe there is a yolk sac or embryo inside, but as a result of poor resolution of your machine, you cannot see that embryo or yolk sac. For that purpose, you can ask a patient to come for a scan after 2 weeks so that you can see whether maybe the yolk sac or embryo develop after that period of time. So this video is I'm going to post it in my YouTube channel, General Radiology. So please, you can rush and watch. If you watch it, if there is any contribution or any comment or any suggestion, you can give. And if you have any question, you can ask. And please, when you watch, try to subscribe, like and share so that many people can see it and watch. This is just a first video, and we are going to do the other video, other series of video about obstetric scan. After obstetric scan, we are going to talk deeply about abdominal pelvic scan and other types of scan, and we are going to post it in the YouTube. Thank you so much.